Hello, future doctors. Welcome back to MedSteps ECG Series. So far we have learned day 1 ECG basics and day 2 about P wave, and in day 3 we learned about PR interval, and day 4 about QRS complex, and day 5 ST segment. So today we are going to learn in this day 6 about the T wave, one of the most important ECG components for diagnosing ischemia, electrolyte abnormalities, and life-threatening cardiac conditions. So without time waste, let's begin. So first in step 1, you can see here what is the T wave. The T wave represents ventricular repolarization. So here you can see this is the ventricular repolarization. Okay, so what is this repolarization means? So after a cell becomes electrically activated and depolarized, it must return to its resting state. So this recovery process is called repolarization. Okay, for example, you can see here, imagine charging your mobile phone. So right now this is your mobile phone, you are charging your phone, you used your phone, then after you are charging your phone, then whenever you are using phone, that part we called, that is depolarization. So recharging the phone, it will be like repolarization. Okay, similarly, why this thing is important means the heart contracts and the heart will become recovers, and whenever the heart become recover, then we call that is T wave appears. Okay, so repolarization means it represents the recovery pace of the ventricles, and after contraction the repolarization return to resting state. Okay, so we have some sequence of ECG events. So remember this sequence. First we have to focus on P wave. P wave means atrial depolarization. Next, QRS complex means ventricular depolarization, and ST segment means ventricles fully activated. At last, we can see here that is T wave. T wave means ventricular repolarization. Okay, so we have one mnemonic, that is P, QRS, and T. P means we are preparing, so that is we call atrial depolarization. QRS means pump, like ventricular depolarization, and we can see T means recover. Okay, so ventricular repolarization. So this is the um, sequence we have to follow. So next you can see here, that is normal appearance of T wave. How the T wave will appear. So normal T waves are smooth, okay, and rounded and asymmetrical and upright in most leads. So normally the T wave will be like positive. You can see in lead 1, lead 2, V3 to V6. So this every leads are positive of T wave. Okay, and normally negative in AVR. Okay, and can be variable based on that current passing, like lead 3 and V1. Okay, so this it can be variable. So in lead 1 to lead 1, lead 2, and V3 to V6, it will be like normally it will, the T wave will be like positive, means it will be like look the this type of structure you can see. Okay, so we call that as P, like positive. If it's going down, the T wave is going down, then we call that is negative. So in normally AVR we can say negative, and it can be variable in L3, lead 3 to lead 3 and V1. Okay, next we can see here why is the T wave is important. The T wave is extremely sensitive for ischemia, myocardial infarction, and hypokalemia, and ventricular hypertrophy, and central nervous system disorders. Many serious diseases first show T wave abnormalities. Okay, so that's why this T wave is very important. So this T wave inversion, one of the most important ECG findings. Normally, the T wave should be upright. When the T wave points downwards, it's called T wave inversion. You can see here, this is T wave If it's going down, we call that is T wave inversion. So the T wave inversion main causes will be like end stemming. Okay, main cause will most common cause will be like myocardial infarction is the most common, and you can see end stemming and ventricular hypertrophy, bundle branch block, and pulmonary embolism. These are things can cause. In exam point of view, you can see here that is T wave inversion. We have to think always ischemia. In clinical example, you can see here when once patient present with chest pain, the ECG shows T wave inversion in V2 to V5. Then we have to suspect patient have possible myocardial ischemia. Okay, possible myocardial ischemia. So that's why T wave is very important. So T wave inverted means always we have to think about myocardial ischemia. So next you can see here that is hyperacute T waves. So very early sign of stemming, and before ST elevation develops, like T wave become tall, broad, and symmetrical, and these are called hyperacute T waves. Then after you can see early stemming. Then after you can see emergency reperfusion needed. Okay, so next hyperkalemia and T waves. Hyperkalemia and T waves one of the most important emergency ECG diagnosis. So that means hyperkalemia and T waves, you can see the T wave will be like high potassium level causes tall, narrow, and peaked T waves. You can see here peak T waves means you can see like this type of peak structure you can see, and PR like A or V type structure, and PR prolongation means um, PR prolongation, you can see this type of structure, and QRS widening, the QRS will become wide, and sine wave pattern you can see, and next one cardiac arrest. Okay, so this is the main high yield point here. Tall peak T wave, whenever you are getting that time, you have to think about hyperkalemia. Okay, in clinical example, a dialysis patient arrives with weakness, and ECG shows tall pointed T waves. Then diagnosis hyperkalemia, because the dialysis patient the kidney is not functioning properly, so we can see more amount of potassium in body, so it will cause hyperkalemia. Okay, next you can see here that is hypokalemia. Hypo means low potassium. The low potassium causes flat T waves and inverted T waves. Okay, so in additional findings you can see prominent U wave. This is the hallmark of hypokalemia. In hypokalemia, mostly we can see U wave. This is the most common. So this is a prominent U wave hallmark of hypokalemia. Okay. So this ECG patterns, it will show like this flat T wave and prominent U wave. Okay. So flat. This is T wave become flat, and you can see U wave that is going up. So we call that is U wave. Okay. So whenever you are getting prominent U wave, we have to suspect patient have hypokalemia. So in exam point of view, if U wave is coming means think always low potassium. Okay. Next, T wave in myocardial infarction. During myocardial infarction progression, we can we can divide into total 4 different stages. Stage 1 will be like we call hyperacute T waves. So it will be like in V type structure. It will be like normal. So hyperacute T waves. In stage 2, we can see ST elevation. Okay, so this is the ST elevation. Once it's going to stage 3, we can see T wave inversion. In stage 4, pathological Q wave will be more. It will go more. Okay, so that is stage 4 of myocardial infarction progression. So we have very easily for remembering. I have one mnemonic, that is first one tall T, then after ST up, then after T down, then after Q deep. Okay, tall T means we can see V structure will the V type variable you can see tall T Next ST up, the ST will become elevated. Next ST down, the ST will become down. Then after Q, deep. So we have one syndrome we called Whelan's syndrome. Very important for USMLE point of view. So it occurs due to critical LAD stenosis, means left anterior descending artery, coronary artery stenosis. If patient have stenosis in that artery, we call that is Whelan syndrome. In ECG findings, we can see deep symmetric T wave inversion or biphasic T waves, and in V1, in V2 to V3, because LAD, right? So we have to suspect anterior or septal. So that's why V2 to V3. Okay. So in clinical importance, we can see that is high risk of massive anterior myocardial infarction. Okay. So next, systemic T wave analysis. Whenever you see a T wave, ask yourself, is it upright? Is it inverted? Is it peaked? Is it flattened? Are U waves are present or not? These questions help diagnose many disorders. Okay, in FMGE point of view, in high in if you are preparing for FMGE or NEET PG or USMLE, these are the questions. These are the things, very high yield points we are discussing now. That is, T wave means ventricular repolarization, and T wave inversion means we have to suspect ischemia. Tall peak T waves means we have to suspect hyperkalemia. Flat T wave means we have to suspect hypokalemia. And U wave means we have to suspect hypokalemia. And hyperacute T wave means we have to suspect early STEMI. Okay. Next, you can see here that is rapid revision. In rapid revision, why does the T wave represents? It will represent ventricular repolarization. Tall peak T wave will be like hyperkalemia. Flat T wave will be like hypokalemia. And T wave inversion will be like ischemia. Prominent U wave, you can say hypokalemia. Hyperacute T wave, we can suspect early STEMI. Okay. We have one beginning question here. A 60 years old patient with chronic kidney disease presents with weakness. ECG shows tall, narrow peak T wave. Most likely diagnosis, that is hyperkalemia. Okay. So in ECG interpretation, always first we have to check P wave, atrial depolarization. R interval will be like atrioventricular conduction time, and QRS complex will be like ventricular depolarization. Next, you can see ST segment. Next, you can see that is T wave ventricular depolarization. Okay, so this is the important point. I will share this notes in Telegram channel. If you want this notes, you can take in from Telegram channel. So today we learn the T wave from basic physiology to advanced ECG interpretation, including ischemia, hyperkalemia, hypokalemia, and myocardial infarction patterns. So in day 7, we will learn from ECG paper basics, including small boxes, large boxes, time measurements, voltage calculation, and the foundation of ECG interpretation. So see you in next ECG lesson on MedSteps by Dr. Anand. Okay. So till the time, take care. Bye bye.